When you think of our health equity strategy at Rush and its evolution over the last few years, we can sometimes forget about its humble origins in places like the Adolescent Family Center.
In 1974, a historic signing agreement between the Chicago Foundlings Home and Rush Hospital is what led to the actual launch of the Adolescent Family Center.
The AFC is a grant-funded clinic that serves those 12 to 25 for sexual and reproductive health services. So that might be birth control counseling or STI testing, pregnancy testing, and sometimes it's just like managing symptoms that they have, and sometimes it's just having a conversation with a professional about any of these topics.
You have to imagine this neighborhood in the 1970s. The West Side extended all the way from Austin Boulevard to the Loop. As the period of the Great Migration brought many, many families from the South to the West Side of Chicago. And the Adolescent Family Center arose because of the need for adolescents to get the most optimized prenatal care.
There was an interprofessional team that included advanced practice nurses, physicians, and really important, a social worker. There were few clinics at the time that had an embedded social worker. And this interprofessional model is what created this innovative framework of care for young people that met their total needs. It was well before its time. It was a model that was bold and people didn't know if it would work. And that model exists to today.
So I think social work is fundamentally relational work. It is building, the fancy term for it is a therapeutic alliance, but it's really just interacting with another person and then kind of using the relationship you create to help them better meet their own needs, better care for themselves, be the person they want to be.
We provide therapy, any of the resources that they need. Most of our patients, they need more than just medical.
A lot of our patients here have some kind of trauma history or some kind of exposure to toxic stress. So a social worker is really helpful in giving them space to process that. Mental health is hard to access, especially for youth.
The Adolescent Family Center is really the manifestation of health equity at Rush, making sure that everybody all get the chance to be healthy, not just them, their families, and their babies.
I was a teen mom, so I see myself in these girls. When we tell the 18-year-old, you're pregnant, gives me flashbacks of when I was in their shoes. I wish I had the resources that the patients have. What AFC does for these patients, the resources, they feel safe here. They feel like they're part of us, right?
I find it very satisfying to be a social worker with AFC just because of the population that we do serve. I just find it rewarding seeing a smile and being able to help them work through their challenges.
When you meet somebody where they are and you help them actualize their dreams, even dreams that they don't know or appreciate that they have, it's always rewarding when they achieve them. They make you feel like you're a part of their lives. So I wish every community had an AFC.
This is a place where you can spend a lot of time with a patient, connect them to a variety of resources, and really take your time providing them with the best care, not just medical care, but that social support care.
In addition to adding family planning funded services back in 1985, a nurse was added to be able to provide education, to go out in Chicago public schools and educate young people. We provide thousands and thousands and thousands of hours of sexual health education. The AFC has just continued to add in additional services, including a community health worker, making sure that patients get social determinants of health screeners and linkage to food resources through our Food as Medicine program. We continue to evolve. Affirm, the Rush Center for Gender, Sexuality, and Reproductive Health, is co-located up in the adolescent family space and supports our ability to expand services to gender diverse youth as well.
The Chicago Foundling Home has provided over the years more than $13 million of support. And that sort of foundational support has allowed us for 50 years to take care of adolescents during their pregnancies and afterwards.
Without this visionary decision by the Chicago Foundlings Home, none of this would be possible.
We're very, very pleased to be celebrating this 50-year anniversary. We're very proud to be a model for care for adolescents in the country, and we can't wait for the next 50 years.